Hey everybody, welcome back to another episode of the Good Lockstocks podcast. I'm Dr. Eric Perret.
And I'm Dr. Asi Perret.
As you guys know, we love to help people who are experiencing hair loss. If you like these videos, please like, share and subscribe. It would help us a lot.
Guys, we've been getting a lot of questions about this. Microneedling. Does it work? How do I do it? And what do you guys think of it? Today we're going to be discussing just that, and we're going to let you know exactly how you should be microneedling. Stay tuned.
Welcome to the Good Lockstocks podcast.
So, microneedling. It's also known as percutaneous collagen induction therapy, and studies have shown to have very positive results, especially when in combination with other therapies.
Preliminary studies have shown that if you incorporate microneedling into your home routine, there can be some very positive outcomes on hair growth. So Eric, tell us, what is microneedling and how does it work?
Simply put, microneedling is when there are tiny needles making micropunctures in your skin. The micropunctures lead to an increase in blood supply to the area, along with growth factors that activate stem cells. This stimulates the body's natural regenerative process.
This increase in growth factors actually causes a change in shaft diameter. So we see a lot of these vellus hairs start gaining diameter and becoming normal hairs. And this is what thickens out your hair and makes it look better. And for those of you who haven't watched our previous videos, vellus hairs are just miniaturized normal hairs. So you never actually lose your hair. Your normal hair just becomes miniaturized, and that miniature hair is called a vellus hair.
One of the first uses for microneedling was for skin grafts, which actually showed an increase in survival rate. Another thing that's been used for is skin rejuvenation and melasma, as well as hyperhidrosis, which is excessive sweating.
So guys, besides all this regenerative effects that microneedling gives, it also helps with delivering drug therapies locally. So things like minoxidil, latanoprost, topical finasteride, it really helps all these chemicals penetrate the skin. So we really like to use it in combination with all these drugs. So we love to use microneedling to help these chemicals penetrate the skin. But what we also do is we use this to help our PRP penetrate the skin, which is platelet-rich plasma, which is a regenerative treatment that we use. And this helps that regenerative process even further.
We'll get into PRP at a later stage or in another video.
So we know that there are different types of hair losses, and they respond to different types of treatments. So Eric, what type of hair loss can we treat with microneedling?
That's a good question. It's shown to be most beneficial for traction alopecia, but it's also used for androgenic alopecia, female pattern baldness, as well as alopecia areata.
So Eric, I know there's a lot of these microneedlers on the market, and my biggest question is, which one should I get? How deep should I go? And how often do I have to use this?
I'd like to start by saying that we actually prefer the dermapen because it gives you vertical needling instead of the rolling, which can actually break hairs. However, not everyone can afford a dermapen, it's very expensive, and so the rolling is fine to do at home. I like to recommend you do it 2 to 3 times a week, along with some other therapy like minoxidil or some take-home PRP. As far as depth goes, if you're doing it at home, I'd say anywhere between 0.5 to 1 millimeter. Anything more than that would be rather painful, and we also don't want you to be over-penetrating at home. It can cause scarring and therefore lead to hair loss. So, nothing more than 1 millimeter at home.
There are some other minor risks associated with this. One is infection, that's most important. So please, let's keep it clean. You want to clean the derma roller itself. Just a bit of alcohol is fine. And then also clean your scalp. So shampoo your scalp before you do this. Okay? The next thing that can happen is hair shedding. Now this is typical of every stimulatory treatment. Okay? If you start minoxidil, you can get some hair shedding, and if you start derma rolling, you can get hair shedding too. Do not be alarmed, it just means it's working well, and the new hairs are coming through. And as Eric mentioned, scarring. Make sure you don't over-roll, don't overdo it. Just about a minute is absolutely fine, and depth at home, let's just keep it to a 1 millimeter maximum. If you go to your clinic, they can do a bit of a deeper microneedling for you, but at home, keep it safe. In my next video, I'm going to be discussing my own personal hair loss regimen because I've been getting a lot of questions about this. So be sure to watch that too.
Thanks so much for watching, guys. If you like this video, once again, please like, share and subscribe. See you next time.
Bye now.